My name is Alex Enriquez. Uh, I talk about the lower versus traditional treatment results for neonatal hypoglycemia. Definition: the World Health Organization defines hypoglycemia as a blood glucose concentration of less than 3 millimoles per liter or less than 54 milligrams per deciliter in severely malnourished children. Hypoglycemia is the most common metabolic problem in newborns and may lead to persistent brain injury. Because neonatal hypoglycemia often is asymptomatic, however, there is no consensus regarding the threshold glucose concentration at which treatment for asymptomatic neonatal hypoglycemia should be initiated.
Diabetes means hypoglycemia, meaning low glucose in the blood. Hypos are most common with people taking insulin. If you're on medication that can cause hypos, it's important to be aware of the signs of hypoglycemia, which can include feeling tired or weak, being hungry, becoming pale, sweating, feeling anxious or nervous, a tingling sensation in the tongue or lips, trembling and shakiness. In more severe cases of hypoglycemia, someone with diabetes may experience confusion, convulsion, loss of consciousness. The NHS lists the following as to why hypos may occur. If you take more diabetes medication compared to the amount of carbohydrate you've eaten, if you miss a meal, if you take more exercise than normal, if you drink alcohol on an empty stomach. It's advisable to treat a hypo as soon as you recognise the symptoms. Diabetes UK recommend that you treat a hypo by having 15 to 20 milligrams of a fast-acting carbohydrate. Having 3 or more glucose tablets will raise blood sugar the quickest. However, if glucose tablets are not available, other options include 250 ml of a non-diet soft drink, 250 ml of fruit juice, or 5 sweets such as jelly babies. If your next meal is not due, it's recommended that you follow the short-acting carbohydrate with some longer-acting carbs such as a slice of bread or a portion of fruit. It's recommended that you retest your blood sugar 15 to 20 minutes after eating and retreat if your blood sugar is still lower than 4 millimoles per litre. If someone experiencing hypoglycemia is unconscious, the NHS advises that they are put into the recovery position and either given glucagon or an ambulance called. If there is no one available who is trained to give glucagon, just call the ambulance.
Application in medicine. Newborns have found to have asymptomatic moderate hypoglycemia between 3 and 24 hours after birth were randomly assigned in a 1:1 ratio to receive treatment when the glucose concentration was lower than 36 milligrams per deciliter. In the lower threshold group, the aim was to maintain the infant's glucose concentration at 36 milligrams per deciliter or greater. In the traditional threshold group, the aim was to attain a glucose concentration of 47 milligrams per deciliter or greater and maintain that level. Treatment intervention which were similar in two groups were supplements, oral feeding, tube feeding, or intravenous glucose administration.
Some days it's blindingly obvious. I look at her and I go, you're hypo. She's white, her lips have gone white. She's a bouncy child, and when she's hypo, she's very quiet and mellow. So sometimes it's about behaviour, sometimes it's about the way she looks, sometimes she's really grumpy. So there's no such thing for her as a typical hypo. They're all those things.
George is so laid back, such a loving young boy, young man, that I can tell instantly if he's going low, because he'll be a little bit on edge, he'll be a little bit snappy.
He gets quite clammy, he gets quite sweaty, and sometimes can get really emotional. It makes him, he goes one of two ways. He can either get quite upset, or it can make him a little bit angry.
Pros and cons. Pros: the duration of hospital stay of the newborns of one and of their mothers were similar in two groups, as were health care costs. Cons: adverse events were reported in two infants in the lower threshold group, one newborn with signs of hypoxic brain injury on magnetic resonance imaging had convulsions during normoglycemia, and one infant died from a severe respiratory infection after the neonatal period.
It's time for another Nurse Nugget. Stay tuned for a quick way to remember symptoms of hypoglycemia. It's super easy to remember symptoms of hypoglycemia. We probably even all felt it a time or two after exercise or after some stress, our blood sugar going down. So what I want you to remember is the acronym TIRED, T-I-R-E-D. The T stands for tachycardia, I stands for irritability, or you can say, what we call hangry now. They get really cranky. R is for restlessness. E is for excessive hunger. You are starving because you want to bring up that blood sugar. And D is for diaphoresis or dizziness. Some other symptoms that might go along with hypoglycemia are headache, shakiness. If it goes low enough, you could have mental changes or even tingling around the mouth. And since we're talking about hypoglycemia, let's throw in some hyperglycemia to go with it. So for hypoglycemia, you need to know the 3 P's. The 3 P's will be on your ATI and your NCLEX. Your 3 P's for hyperglycemia is polyphagia, polydipsia, and polyuria. What do these things mean? Polyphagia is excessive hunger. You're hangry, you're starving, you want to eat. Polydipsia is excessive thirst. You're super thirsty because you're urinating all that sugar out. And we will get to that later on some of the patho videos. And polyuria, which is excessive urination. Your body is trying to eliminate some of that sugar, so it's pulling fluids and trying to get you to pee it all out. So remember, hot and dry, sugar is high. Also, just so you know, there are a few other symptoms that they might have. They could have vision changes, they could have fatigue, weight loss, headaches, difficulty concentrating, and also vaginal and skin infections increase due to the excessive glucose. All right, that's your little nursing nugget. I hope that helps you with hyper and hypoglycemia. Thanks for watching. Make sure you share my videos with your friends and drop some comments below if you have any suggestions as far as what you would like me to cover. Also, if you head to my Facebook and Instagram page, I do NCLEX questions of the day. So I'll see you on the next video.
Issue applied in Ecuador. Of the 4 newly preterm infants with low weight, 28 presented hypoglycemia, 82% of them debut with symptomatic hypoglycemia, and 18% with asymptomatic hypoglycemia. It concludes that there is a close relationship between prematurity and the appearance of neonatal hypoglycemia.
Neonatal hypoglycemia is one of the most common problems encountered by the staff in the nursery after a child is born. It simply means that the baby's sugar is lower than what it should be. Now, generally that's defined as something less than 30 milligrams per deciliter within the first 24 hours of life, or 45 milligrams per deciliter thereafter. If the problem is not detected and treated quickly, it can have long-term consequences for that child. There is a group of newborns that clinicians know will have problems metabolizing sugar. Specifically, children who are born of mothers with gestational diabetes. They've had a great deal of blood sugar coursing through their veins because the mother was producing that excess sugar while they were in utero. When that baby is born, suddenly that supply of excess blood sugar is cut off. But yet the baby was producing a lot of insulin to compensate and metabolize that blood sugar. Once the baby is born, it takes a while for the baby's system to realize, hey, we're not getting all of that blood sugar anymore, and we don't need all of that insulin to be produced. As a consequence, when that baby's born, it can have a dangerously low blood sugar level, and it needs to be corrected promptly, either with intravenous therapy or with a feeding. And it is important for those children to be monitored closely once they've had an abnormal level, because that's an indication to the clinicians that, hey, this baby isn't regulating very well yet. And so it is extremely important that the healthcare providers monitor the blood sugar level of the newborn. If you have questions about whether or not you and your child...
Conclusion. In otherwise healthy newborns with asymptomatic moderate hypoglycemia, lower glucose treatment threshold 36 milligrams per deciliter was non-inferior to a traditional threshold 47 milligrams per deciliter with regard to psychomotor development at 18 months.
Welcome to our video series, Taking Control of Your Child's Diabetes. My name is Lisette. If your child has low blood sugar, also known as hypoglycemia, you may have many questions. This occurs when there is little glucose in the blood. Blood sugars below 70 are considered low. When this happens, the body does not have the source of energy it needs to function properly. Hypoglycemia may be caused by missing meals or snacks, and also if there's too much time between meals. Additionally, it can happen if your child exercises more than usual, has received too much insulin, or if he or she is sick, especially with vomiting and/or diarrhea. It is very important to know the signs and symptoms of hypoglycemia because a low blood sugar can happen quickly and must be treated immediately. If not treated, loss of consciousness or a seizure can occur. Signs and symptoms of hypoglycemia are shaking, sweating, feeling anxious, dizzy, hungry, a fast heartbeat, or having impaired vision, weakness and/or fatigue, headache, and irritability. I am often asked how to treat hypoglycemia. If your child has signs or symptoms of hypoglycemia, check his or her blood sugar immediately with the glucometer. If the sugar is low, which is below 70, have your child eat or drink a 15 to 20 gram fast-acting carbohydrate snack that contains only carbohydrates with no fat or protein. Fat is absorbed slower in the stomach, so it will take longer for the carbohydrate to be absorbed and enter the bloodstream. Chocolate candy should not be used to treat hypoglycemia because it contains fat, which slows digestion and does not allow glucose to enter the bloodstream fast enough. Fast-acting carbohydrates should raise the blood glucose level within 15 minutes, and the child should begin to feel better. It is important to check the blood sugar level again after 15 minutes of the child having consumed a fast-acting carbohydrate. If it is still below 70, give another fast-acting carbohydrate and recheck the blood glucose level 15 minutes later. After treating the hypoglycemia successfully, give a light snack that contains 1 carbohydrate and 1 protein if the next meal or snack is more than 1 hour away. This will keep the blood sugar level within goal range. Now you know about hypoglycemia. Please remember, hypoglycemia, which is a low blood sugar, should be treated immediately. We are here for your child and to support you. If you have any questions, do not hesitate to contact your diabetes team. Please continue watching this video series to learn more. Thank you for being an active member of your child's diabetes team.
Thank you.